back into nursing homes in the state, saying that it's necessary in order to counter the psychological toll that isolation has taken on residents in long-term care facilities. But other states like Pennsylvania and Georgia, they're focusing in on ramping up testing in nursing homes. And the New York Times is reporting 1/3 of all coronavirus deaths in the country are connected to long-term care facilities, more than 28,000 people. Joining me right now is Mark Parkinson. He's president and CEO of the American Healthcare Association, which represents over 13,000 long-term care facilities. It's good to have you back. Thank you for being here, Mark. On what Florida's governor is working on, this plan to allow visitors back into nursing homes, what do you think of that? Do you think they can do that safely right now?
I don't. The thing that makes this virus so incredibly dangerous is that people can contract it and have absolutely no symptoms. And in fact, that's what's caused this problem to begin with. The fact that in January, February, and early March, there were tens of thousands of people in the country that were running around having the virus and showing no symptoms. They visited nursing homes. Many of them worked in nursing homes. Some of them sold goods to nursing homes. And unwittingly, they spread the virus. It would be a major mistake to let folks back into buildings until we can test them and make darn sure that they don't have the virus. Because if we allow visitors, inevitably, some of them are going to have the virus and will continue to spread it.
Testing is something that you have been kind of sounding the alarm on for a very long time. Honestly, since we started talking about this, which feels like a million years ago, but really was just in March when we started having this conversation. The White House is now pushing for states to ramp up testing in nursing homes in the next 2 weeks. I wanted to just kind of get your gauge on what percentage of nursing homes right now have enough testing to make sure that residents and workers are safe.
Well, first of all, we can't solve this problem until we test everybody. Because until we test everybody, we don't know who has it. We don't know what residents have it without symptoms or what staff members have it without symptoms. And what we learn when we test everybody is that there are a lot of both. A lot of residents and staff have this with no symptoms and again are accidentally spreading it to other people. So far, about 25% of all nursing home residents have been tested. About 5% have been positive, which doesn't sound like a very high percentage until you learn that a good percentage of the nursing home residents that are positive, unfortunately, end up dying. So until we can get the other 75% tested, and not just tested once, but tested on a really regular schedule so we know exactly what's going on in the building, we're not going to be able to beat this. We've really got to continue to ramp it up.
Do you see any good news on the horizon for that anytime soon, though?
I do. The availability of tests continues to expand. You know, so far in the country, we've tested about 10 million people, but we're developing the capabilities to test literally millions every week. And that's what it's going to take until we get to a vaccine. So we've gone from almost no test available at all, nursing homes either getting none or maybe 2 or 3, to where we are right now, where we're getting, you know, a more robust supply. We will get to the point, you know, I think in the next month or two where there are millions of tests available every week. But until we get to that point, again, I think it would be a mistake to open the facilities up to outside folks.
And when I saw that statistic that from the New York Times was reporting about 1 in 3 people who've died in this pandemic are residents or workers in nursing homes, that just really is crushing. And I wanted to get your message to families, millions of Americans out there who have a loved one that is in a long-term care facility. What is your message to them right now?
Well, I agree with you. It has been devastating. You know, as a person myself who spent my entire career taking care of residents and all the providers who spent their entire lives taking care of residents, to see this happen to these residents, to their family members, to the staff, have been absolutely devastating. And our hearts go out to each and every one of you. And please be assured that we have folks that have worked 60 days in a row, double shifts. They're not going to abandon these facilities. They're going to do everything they can to keep your loved ones safe. And if we can get the resources that we need, we can make this better. There are literally tens of thousands of people that have recovered from COVID in nursing homes. So that's a promising thing that's encouraging. We need more positive stories like that, and we're not going to quit until we're able to do that.
Yeah. Mark, thank you very much. I really appreciate it. Ahead for us, Russia is now reporting over 10,000 new cases per day. It now has the second most infections of any country in the